Hi, everyone. My name is Nicollette. I am a Master's of Social Work student at the University of Toronto, currently completing my practicum with For a Safer Space. Today, we'll be sharing information about depression in the violence against women sector and how it can affect ourselves personally and those around us. Globally, it has been estimated that 1 in 3 women has been beaten, forced into sex, or otherwise abused in her lifetime. This evidence supports how women will experience depression and other mental health conditions at higher rates, resulting in adverse health and life concerns. Violence against women should be seen as a public health priority, as the silent pandemic of violence against women and girls leaves no country or community untouched. Depression is a mood disorder and can be defined as a persistent feeling of sadness and a loss of interest that can interfere with one's daily functioning. As women and girls continue to face various forms of violence and oppression, this perpetuates the cycle of gender-based violence and unequal power structures. In addition to their health, women and girls now face cognitive effects from the trauma and abuse, resulting often in anxiety, PTSD, and depression. While the most common identified damages of violence are physical injuries, the unseen damage also can penetrate deeper. Those working on these issues have seen bruises and broken bones heal. But if you ask a woman what is the greatest and lasting harm inflicting from an incident of, for example, a sexual assault or experience of abuse by her life partner, she will tell you the psychological, emotional, and the mental impact. This is why the mental health needs of women and girls who experience forms of gender-based violence can be seen as an essential service and social injustice that needs urgent attention. So it's important to remember that although physical violence is detrimental, psychological, emotional, mental, financial, and also verbal forms of abuse can also have its equal long-lasting effects. Physical health concerns associated with the violence that women experience include chronic pain, disabilities, disorders in the stomach, irritable bowel syndrome, sleep disorders, and general reductions in physical functioning and health-related life quality. Recent analysis also indicate that the violence experienced by women may also be associated with women's reproductive health, specifically infertility, pelvic and inflammatory diseases, pregnancy complications and miscarriages, sexual dysfunctions, sexually transmitted diseases, including HIV and AIDS, as well as unsafe abortions and unwanted pregnancies. The violence experienced by women during their pregnancy is often associated with femicide and causing direct harm to the fetus, which can cause and result in preterm births and injury and low birth weight. Violence experienced by women is consistently associated with higher rates of depression, anxiety disorders, especially post-traumatic stress disorder, protracted disabling sleep disorders, self-harm, suicidal behavior, as well as substance use and dependency. For Aboriginal women with abuse histories, rates of these conditions, especially depression, are actually higher, though Aboriginal women exposed to violence self-rate their health at the same levels as non-Aboriginal women do. The violence experienced by women is often associated with health risk behaviors, including coping with alcohol, drugs, smoking, as well as engaging in unsafe sexual behavior and physical inactivity. Depending on the comfort of the client as well as the recent time of the event, survivors of violence with depression may also explore options of therapy such as trauma-focused therapy, cognitive processing therapy, exposure therapy, or medication, depending on the recommendation of the doctor. And it's also important to remember that you are not alone and that there are others in your community and services that are in aid, and recognize the trauma experienced by women and recognize the need for these essential, applicable, and helpful services. Thank you for taking the time for watching this video. I hope it was helpful. and take care.